The Fiji Health Sector Support Program recently facilitated a 3-day roundtable discussion between the Ministry of Health and an internationally recognized group of typhoid experts that included geneticists, mathematical computer modelers, epidemiologists, physicians and public health experts to assist the ministry in developing strategies to tackle typhoid in the country. Since the initial spike in 2005, when there were 189 confirmed cases in the first 8 months of the year, there has been intermittent outbreaks of typhoid in Fiji, spiking in 2008 when over 400 plus cases were confirmed, and again in 2010 when over 500 additional cases were verified.
We're really trying to do something about typhoid since then. And then these small outbreaks that are coming up from each rural villages and settlements. And as soon as we try to control from one settlement, the outbreak is coming from the other settlement. So, I think it's an issue.
The messages, though, are pretty clear, and that is that typhoid is a disease which is usually transmitted with either water or food. One important issue that's emerged is the true burden in children. One reason why this is unknown is that the definitive diagnosis of typhoid is based on culturing the blood. And for obvious reasons, when people take blood from children, they tend to take a small volume. And small volume means it's much less likely to be a culture positive, even if the child has typhoid. For this reason, we may be underestimating the true number of cases of typhoid in children, and that's something that has to be looked at.
Understanding the transmission and disease burden of typhoid in children and young adults is essential in any effective strategy to combat typhoid.
What has been coming out in the discussion is, we have to do that, and we probably have to look into our own researches in terms of typhoid, because we need these information in order to plan further.
In the short term, the ministry has been advised to improve the detection of the typhoid organism in hospital labs, standardized treatment in children and adults, as well as improve the dissemination of information in affected and at-risk communities. But in the longer term, there are other potential risks that need to be considered.
As we speak, in India and other parts of Asia, there have been strains of typhoid sweeping across the continent which are drug resistant, heavily drug resistant, and they would render the current drugs that are in use in Fiji ineffective if they got into Fiji. So there is a possibility that the situation could get a lot worse, actually, if we start to get drug resistant strains creeping in. And this may happen even in the absence of inappropriate use of antibiotic, just by chance. Just if one traveller comes with the organism and somehow it becomes entrenched in Fiji. So there is a risk that if we do nothing at this stage, or if we say, well, we're getting so many cases of typhoid, we can manage them, let's just leave it. Actually, it may not stay the same, it may get a lot worse. So really there is a sense of urgency that the problem has to be tackled now.
The roundtable discussion was a unique opportunity to draw from the most knowledgeable minds in the world, and is an important step as the Ministry of Health works towards achieving its goals.
We can achieve that, where we are only seeing one blood culture positive patient admitted to the hospital in a year, or maybe 2 in a year, or none in a year. If we can go back to that, I think that will be a good achievement, or a good guide as to what's the reduction of typhoid we want in the next 5 years.